Welcome to Hope in the Face of Cancer, where we share real stories of courageous people in their cancer journey. Today, we are honored to have Dr. Ishwaria Subbiah, a trailblazer in the fields of medical oncology and palliative care, with a career dedicated to reimagining how we approach cancer treatment and support. And she's a CanCare board member. Her work spans two of the nation's leading cancer care institutions, having held pivotal roles at MD Anderson Cancer Center and the Sarah Cannon Research Institute. In today's conversation, we'll explore her journey, the innovation she has spearheaded, and the hope she continues to bring to patients, families, and the entire cancer care community. Ishwaria, thank you so much for joining us today.
Oh, it's such a pleasure to be here. Thank you for having me.
Well, I know our audience will learn so much from your story, and I really thought it would be great if we started by them getting to know you a little and kind of what motivated you to take this journey that you've had in oncology. So take us back a little bit. How did all of this start for you?
I grew up around healthcare and medicine. I'm the third generation of physicians in my family and
Mm,
the second generation of oncologists. And so
mm,
to me, taking care of people is less of a job and more of just a way of life. It's what I grew up around. And so I was exposed to oncology from a very early point in life. And so my mom's a medical oncologist, and her her work was just a part of our everyday life.
mm.
I would spend time in her infusion center growing up, doing
Yeah.
homework there. There's a great little fridge with popsicles, big comfy chairs. And so it's just taking care of others is just a part of the DNA. And so in that way, um, picking oncology as the focus of my professional life was um, uh, a relatively easy
Mm.
decision, so to speak. And then
When do you
taking
think
care,
you knew? Was there a particular age or something that you just said, "This is what I want to do too, Mom"?
I think I just found a natural draw to it all along that even when I had the opportunity to consider other fields through medical training, I consistently found myself gravitating back to taking care of people with cancer.
Yeah.
And so, in that way, there wasn't so much an aha moment, but rather moments all along the way when that decision was reinforced
Yeah.
just by virtue of the people we cross paths with.
Absolutely. So you have developed certain focus areas and passions within the oncology space. Tell us a little bit about your areas of interest and what you're passionate about and kind of where that passion comes from.
So, I always thought of uh, this commitment to taking care of people with cancer as truly a blessing and an opportunity,
Yeah.
right? You're crossing paths with people during the most difficult times of their life. And so when you think of cancer, and if I were to think of the last 1,000 conversations I've had with people, it's there's a fear that comes with the
Yeah.
diagnosis. Is it going to shorten my life? And is it going to make me suffer?
Yeah.
And how is it going to affect the people around me, the people whom I'm responsible for as a person? And so I found myself gravitating towards taking care of the whole person.
Mm.
That meant that I would subspecialize in a area of oncology called palliative care and supportive care. This is symptom management, but both physical and psychosocial symptom management um, of a person going through any advanced illness, but especially cancer.
So what does that look like? For our audience that might be hearing some of these terms, for the first time. Yeah, when you hear the word palliative care, especially, I think most people think about that in terms of like end of life, but it's really like caring for the whole person. And I love the phrase you use, supportive care. So, kind of in a practical matter, what kinds of things kind of fall under that umbrella?
It's not uncommon for someone to say that they crossed paths with the term palliative care when someone in their lives needed to get on hospice care or needed to receive end of life care. Palliative care as a field, it really came to be about maybe about 70 to 80 years ago. And it came out of the need to ease suffering at the end of life. And so the roots of the field were, in fact, in end of life care. But really, over the past 4 decades, it has evolved to be symptom management, maximizing quality of life at any point in someone's journey with a particular illness. And so when I think of the people that I'm taking care of, they are experiencing different symptoms from their illness itself, most commonly cancer, or from the treatments for the illness.
Right.
And so in that way, it's maximizing what is medically possible to get some of the side effects of the treatment under control, as well as some of the symptoms from the cancer itself under control. Pain, nausea, trouble sleeping, feeling anxious, feeling depressed, feeling any number of physical and emotional symptoms. These are all part of the cancer care that someone should receive. And so in that way, supporting the whole person is a distinct specialty within medicine as a whole and within oncology.
I love that, supporting the whole person and looking at them beyond, just their diagnosis. You have practiced in places where supportive care has been a priority. Do you see that really across the whole healthcare spectrum, or do we have a long way to go before we're really looking at the patient from that perspective?
When I think of the supportive care practices that I've been a part of, it is one where that time with that person and their family is dedicated to the symptoms. So in a supportive and palliative care clinic visit, there may be a 30, 45-minute or a 1 hour visit. That entire time is dedicated to the symptoms. The time with the oncologist, that primary oncology clinic, you spend a lot of time talking about the cancer itself. What does it mean? What stage is it? Where has it spread if it has? What are the treatments out there? How well do they work? What are the side effects? So just the disease management alone takes up a bulk of the oncology clinic visit. And so in supportive and palliative care, you have a board certified multidisciplinary medical team that's there for, I say, just the symptoms, but we don't really talk about the disease management part because that's why we partner with oncology teams so that the whole person's cared for. This is a field, supportive and palliative care is a field that there's study after study that shows that it benefits patients, improves quality of life, decreases unplanned healthcare utilization like emergency room visits. It reduces the likelihood that somebody receives care that they may not have necessarily wanted, like being in the ICU or being on life support, and that it actually helps improve overall survival. One big study was people who got a palliative care consult actually lived longer than those who didn't. And so the evidence is there. Palliative care, early consultation with the palliative care team is part of really just about every oncology society's guidelines for high quality cancer care. The adoption broadly across the country and world for that matter is very much a work in progress.
Right.
I can see how we're working, it's an uphill journey. It's one that we're all making, without a doubt. But we're still having to work hard to convince leaders that investing and building and growing out a palliative care team is important for a number of reasons. And so we still have a long way to go.
Yeah.
But this is where having our patients and families know exactly what it is, what supportive
Right.
and palliative care is, and actually having them advocate for it.
Yeah.
That's an important channel to broaden the impact and footprint of supportive and palliative care.
That's a great point. We talk a lot about being your own best advocate on this show. For those who may be facing a diagnosis and maybe they're at a healthcare facility that doesn't have as robust of a supportive and palliative care team around them, what advice would you have for them about advocating for themselves and the resources that they may not be readily given after their diagnosis?
How I would guide a person with cancer, or a family member or a loved one who's supporting someone with cancer, is to keep their eyes open for what they're going through, both physical changes, as well as changes that are not perceptible, things that you're
Mental,
feeling.
emotional. Hmm.
Exactly. And so whether it's feelings of anxiousness or worry, whether it's trouble sleeping, whether it's, a pain that's pain is very much on the inside, right? So and so in that way, having that heightened awareness is the very first step to starting the conversation within the core support circle for that person.
Yeah.
So if I'm the person with cancer, I want to have that clarity on what I'm going through so that I can share it with my caregivers. If I'm the caregiver, I want to ask that person that I'm caring for about what they're going through, both physically, but also emotionally. The second step, once you're armed with that knowledge, is talking to the primary oncology team. Look, I'm having a really hard time putting my mind to rest at night to get some sleep. I'm really worried about what's going to happen to my family, what's going to happen to the kids. We haven't told the kids. Whatever it is, where I'm hurting a lot and I wake up at night, I have no trouble falling asleep, but I wake up 5 times a night because my neuropathy is acting up. Whatever it may be. With these reasons, you share with your oncology team. The question to them is, do you have somebody that you work with, a team that you work with that can help me with these symptoms? Do you have a palliative care, a supportive and palliative care team? The answer could be one of 3 things, right? One could be, I don't know. 2 could be, no, we don't. Or 3 could be, yes, we do. And so if it's yes, we do, then it's requesting that referral to them so that you can have this taken care of. If it's no, we don't, or I don't know, it's, is there somebody that you work with? This is asking, again, the medical team, who can help with pain management. So you start to go into, okay, the individual buckets of things you're feeling and going through. Do you have somebody you work with for pain management? Do you have a team of counselors or a clinical psychologist? Who's your support? Where do people turn to for support? And it's getting in that way where that physical symptom burden that you're going through, you have that taken care of. And then that emotional symptom burden, you have that addressed. It may mean that you reach out to your primary care as well to ask, are there mental health professionals that you work with who are particularly good at or have a specialization in working with those with cancer?
Yeah.
And then, without a doubt, I'm of course completely biased because I love and I'm committed to care. But you cannot underscore the importance of community organizations where you have
Yeah.
peer support.
Yeah.
Peer support. And so if you're in a place in the country where there's no palliative care, no psychologists, no counselors, like literally nothing, and there are places like that in our country, is find your CanCare.
That's right.
Find that group where you have people coming together around person-centered elements of the cancer experience.
Yeah.
And just even if you feel like there's a webinar that's coming up or an event that's coming up, it's not really on a topic that's relevant to you, go there, still attend, be in the audience, be a part of a community so that you can see what it's like to go through a journey with others.
Absolutely.
Crucial, absolutely crucial to feel activated as a patient and a caregiver.
Yeah, that's great. Thank you. That's very, very helpful advice. I want to dig into another area of focus and passion for you, and that's reducing disparities in cancer care. So you've, throughout your career, really championed efforts to reduce disparities. So what inspired you to focus in this area? What do you see is our progress here and maybe some of the challenges?
We have to first, when we're talking about disparities, we have to really pause and define what we're talking about,
Yeah.
right? And so this equity, access, inclusion, these are all words that have taken on all kinds of meanings this day and age, socially. From a medical standpoint and from a cancer care standpoint, we're talking about communities that are there in the real world that when we look at their outcomes, for example, how well do they do on a treatment that was FDA approved? These disparate communities seem to get less of a benefit in the real world setting than what was shown in the clinical trial of that treatment or that approach. So these are people who are in our everyday life, race, ethnic minority communities, older adults, seniors, 65 and above, irrespective of your race, ethnicity.
Mm-hmm.
People who live in rural areas, people with less than a high school education. Your likelihood of dying from cancer if you have less than a high school education is like 47% greater than if you're somebody who had a college education.
Mm.
Irrespective of your race, irrespective of your age. So people who are veterans, people who are in people who have other medical problems, like many folks. And I'm talking chronic medical problems, high blood pressure, heart disease, high
Diabetes or
cholesterol, diabetes. So suddenly this emphasis on disparities really becomes about people that you care about or you yourself. So it's really important that when we think of disparities in cancer care, that we not be driven by whatever prevailing narrative there is in society about this work. That what we're talking about are the people in our lives, in our immediate family, if not us ourselves.
Yeah.
One of my very first projects, research questions, was older adult participation on clinical trials. Our seniors, they have the most number of new cancer cases in a year are among seniors, 70-something%.
Mm-hmm.
And the most number of people with cancer at any given time in America are seniors. And so when I looked at the clinical trial participation rate, the clinical trials are where the newest treatments of cancer get tested before they go for FDA approval. Seniors were like less than 10%. Mm-hmm. You're talking about a community that includes our grandparents and our loved ones, our neighbors, our friends, sometimes even ourselves, being carrying such a heavy burden of cancer in the United States, but not getting a seat at the table when it comes to newest treatments for cancer on clinical trials. And so that was what sparked the focus slash professional commitment to making sure what can we collectively do as a healthcare community to ensure every person with cancer, doesn't matter what race you are, doesn't matter what zip code you live in, doesn't matter what degree you have or don't have, doesn't matter how old you are, that every person with cancer has the opportunity to consider clinical trials as part of their care plans. This sparked a series of collaborations nationally and globally that are very much still ongoing. It's going to need system level action. It's going to need state, national, and global action. I'm excited about the momentum, though.
That's great.
Many of our leaders, nationally and globally, both in policy, but also in industry, are, as well as in clinical oncology, they recognize that, okay, we're going to need to actually drive action at the system level and not leave it to an individual, a well-meaning one, to have to Google clinical trials for my husband's cancer. Like, that's an unfair responsibility, burden to place on a caregiver. And so it's good to see system level action.
To that end, and that was really my next question, is like, while the system level change is happening, but oftentimes that happens slowly, like, what can our listeners do today? How can they empower themselves today when it comes to access to clinical trials and things out there that they may not be aware of, or maybe they're not being told about in their treatment journey?
If I have to pause and think of a theme word for our conversation today, it's really activation, right? Right after empowerment, I think. Activation. If you're listening and you're going through cancer, or somebody you care about is going through cancer, you don't necessarily have time to wait for culture changes to come about and for, eye-opening realizations to happen, aha moments to occur. And so in that way, when we're talking about patient activation, family activation, caregiver activation, it's pausing and recognizing that, okay, clinical trials are where the newest treatments for cancer get studied before they ever go for FDA review. So I have to keep an open mind to looking at what are some of the new treatments for cancer that are on clinical trials. The next is to have a point, if you take a notebook to your doctor's visit, or however you organize yourself ahead of a clinic visit, is to make a note to ask, are there clinical trials for my cancer that you're excited about? Do you offer clinical trials in this clinic? Are there new drugs that are up and coming that you're generally excited about? The goal as a caregiver or patient in that conversation is to get some practical points, i.e., does the clinic even offer clinical trials? Do they offer clinical trials for my cancer type? Does my doctor and nurse and nurse practitioner, are they excited about any particular drug out there, or types of drugs, class of drugs? These are all seeds of information that'll be important to take with you. And it's also important to know, is my medical team even keeping up with what's out there? Because the answer to all of the above may be, no, we don't have trials here, and or that we don't really offer. I'm not sure I don't think there's anything exciting out there for your cancer. I would always push back on a statement like that. But it's important to know, is my team on the leading edge of having awareness even of what's out there? Because that may be a cue to seek a second opinion or third opinion. Do you think I can go to hospital X or cancer center Y and get their input just to see what's out there? I just want to see what's out there. That is 100% the right
Yeah,
of any person and family to see what is out there and to get that opinion from trusted sources around the country.
absolutely. Very
And so I
wise.
hope people, I mean, people really should feel empowered and activated to do that and not feel like they're jeopardizing their relationship with their doctors at home.
Right. And being your own best advocate, right? So we talked a little bit about kind of the trajectory and what's happening in the clinical trial space, but there's so much happening with technology in healthcare and AI in healthcare. So how do you see technology, AI, big data shaping the future of oncology? And what are you most excited about?
We talked about a couple of um, advances in healthcare that are dependent on culture changes happening, right? Whether it's palliative care adoption, whether it's clinical trials access. A lot of the barriers are centered around people and culture in health systems and other stakeholder entities. We could wait for culture changes to happen, or we could look to see, are there certain technologies that can be adapted to help overcome some of the barriers to accessing high quality cancer care? And I think AI in oncology is exactly at that intersection. Clinical trials are very burdensome to have in a clinic. Just the administrative burden is very high. And AI technologies have capabilities for new efficiencies to make parts of that easier, and a truly easier, meaning it gives time back to clinical and the research teams. AI platforms can also look at patient data at the population level and find ways to match people with clinical trials. AI platforms can find early signs of side effects coming up with especially a new drug where we don't have decades of experience with it. These are all areas where there's active studies being done to see, can AI just make care delivery a bit easier for everybody involved? AI tends to be an unregulated space, which means everybody's kind of doing their own thing.
Yeah.
And that's a tough one to wrap our head around as healthcare professionals, but also as patients and families. And so it's a space that we're treading responsibly in. I say carefully, but it's carefully so that we do it in a responsible way.
Yeah. That makes sense.
There's so much to look forward to there.
It's very exciting, and it's, I think for most of us, lay people, we can't quite understand, all the applications. So I think your explanation was really helpful. And even if AI was used in a healthcare environment to make the practice more efficient and give providers the opportunity to spend, more quality time with their patients. Man, that's a huge benefit, to someone walking that cancer journey. So I had never looked at it from that perspective.
Without a doubt. It's very much this is a new phase of healthcare. So
Yeah.
it's very exciting. There's also a lot of unknown.
Yeah.
So you'll see the spectrum of opinions out there from folks who say it's practically sliced bread and others who say this is going to be the biggest bust. And
Right.
so we're
Only
still
time will
early.
tell.
Only time will tell. But that's why we have our core group of people we trust, right? And our family, our friends, our community, so that our North Stars are always aligned. So AI can, spit out whatever response at you or answer for you, but you still have to make sure that that makes sense in the context of what matters
Right.
to you and with the guidance of the people you trust.
Absolutely. It goes back to empowerment and your decision making power as a patient.
Exactly.
So you have accomplished so much already in your career, but you have a lot of career ahead of you as well. What are you most excited about, or what gives you the most hope about the future of cancer care?
There are steps that are part of receiving cancer care that are so driven by policy and that are so driven by state and federal policy. And so as I look ahead, what I see is a solid momentum towards streamlining some of these
Mm.
policies so that they're not as burdensome
Yeah.
as they are right now. And so when many of these policies were put in place, they were done really without enough awareness of what the downstream effect will
Right.
be.
Right.
And so we
And how
have the
they
chance.
all interrelate to each other, all these different policies, how they,
Exactly.
yeah.
Exactly. That interrelation, you hit the nail on the head. It's each policy is developed by a team, a group that's focused entirely on
Yeah.
that. Little to
Yep.
no awareness that there's 20 other groups also coming up with their own policies.
Hmm.
And there's one healthcare team, one doctor, one nurse practitioner, PA, and one patient and family who are on the receiving end of all 20 of those.
Yeah.
And so there's some real opportunities as I look ahead to just make the art of caring for somebody less burdensome.
Yeah.
And it's to the point we you brought up earlier, which is just giving some time back.
Yeah.
That's going to be crucial to the health and well-being of the oncology workforce, is to feel some autonomy and regain
Hmm.
control of time. And so that's actually what I'm really looking forward to in the future.
You guided a lot of your career by putting the patient at the center, right? It's, whatever they need, they're at the center of the circle. And I think from a policy standpoint, if that same criteria was used, let's put the patient at the center and really understand how all this impacts them. I mean, that could revolutionize the way healthcare is delivered. But I don't think we're quite there yet.
I don't think we're quite there yet, and I would even expand it to be patient-centered care, to be person-centered care,
Mm,
because that means that you now bring in the viewpoints of the patient, but also of the caregiver and family,
yes.
of the community, the survivor
Mm,
community, of the healthcare team.
mm,
And so many of
yeah.
the implementation struggles with well-meaning policy is because there weren't really voices at the table who can share, oh, hey, this is how we see this policy's implementation mapping out.
Hmm.
And in that way, having a person-centered approach to health policy will actually help mitigate some of the implementation struggles that
Yeah.
been seeing really for the past 30 years or so with federal and state policies.
Yeah.
It's entirely doable. You just have to get the right voices at the table,
Yeah.
and not just the voices who will say what you want to hear. It's
Yeah.
more about voices who will give you insights that'll help shape the implementation part, not the core values of what any individual policy aims to do, but it's all in the implementation science.
Right. Absolutely. If you think out decades from now, if there was one thing that you want to have defined your career, or one accomplishment, that you want to see in your career caring for people facing cancer, what would it be?
I would really hope to have a meaningful impact on state and federal policy.
Mm.
I say that because the current norm, the current state in cancer care and healthcare as a whole, is to put the burden on the clinical teams, the doctors, the nurses, the PAs, NPs, to put the burden on the clinical team and frankly, the patient and family to do the right thing.
Yeah.
And I see the single greatest power in the policy space to actually unburden
Mm.
individuals and to take on that responsibility at the system level.
Mm-hmm.
Referral to palliative care, just as an example, we talked
Yeah.
about that. That's in every single guideline. There's countless studies. If you just had one study and you're a drug, you would have gotten FDA approval.
Right.
One good, a randomized control trial, you likely would have gotten a positive review from the FDA. There's countless ones like that. So what does that mean if here in 2024, we're still talking about how most people with cancer don't have access to palliative care
Yeah.
in the geographic vicinity? Like there's legislation that can fix that. It's stalled in Congress. There's legislation that can fix the administrative burden, whether it's on clinical trials, whether it's just clinical practice. There's legislation that can fix challenges patients have with getting timely access to subspecialties. If we think of what does a professional legacy look like, I'm somebody who is you want the work you do to be scalable and sustainable long after you're gone. That's the definition of legacy, is that it's work that continues to make an impact long after you're gone. I think the greatest untapped space that is out there is in health policy, without a doubt. So I really hope that that we collectively get to do more as an oncology community in that space.
That's an incredible perspective. It's something I think that most of us who aren't in your space don't think about day to day. All we feel is the outcomes and after effects of policy, but we don't necessarily contemplate how that could change. And we spent a lot of time today talking about being your own advocate, but to your point, I think with policy that's focused on people, it lessens the burden of having to be your own advocate in a system that is so complicated today. So I think that's a very admirable career goal. And knowing you, I have no doubt you'll have a great impact in that space.
I mean, it's just thinking through the times where I've been a patient and I've been a caregiver, and it's nowhere close to the depth of what our patients and their families go through. it is exhausting. It's
Yeah.
just physically exhausting.
Yeah.
You may not have run a marathon, but at the end of a day,
That's right.
you physically are wiped out. And
Yeah.
so that way, imagine receiving care in a system that works with you. That's a tailwind, as you take care of that person that you love. And so that's really that hope for the future. And on the point about advocacy, I mean, I'll share one story, which was eye-opening for me. I'll never forget that. Um, right in the maybe it was about a year and a half ago or 2 years ago, right at the start of a chemotherapy shortage that we were having
Mm.
nationally with platinum chemotherapy, cisplatin, oxaliplatin. These are such common drugs that are in so many different cancers treatments. We didn't have enough in America.
Wow.
And it was
Scary.
it was scary because for certain cancer types, these drugs were part of a curative intent treatment. These were part of a chemotherapy regimen that usually had 2, 3, 4 drugs that was meant to cure the person. And suddenly one key drug wasn't available. I happened to be in DC for a different reason, and I was meeting with my congressperson, and we reached consensus earlier than expected. And so I had a few minutes and I brought this up. I was like, by the way, is this platinum shortage on your radar at all? They had no idea.
Wow.
They truly had no idea. And I don't fault them for that because they get their information from sources. And guess what? That was the exchange that put a critical high, 5 alarm issue in cancer care onto the radar of an important legislator.
Mm.
And I say that because each person listening here, they plug in their address and they'll have their legislators' information pop
Yes.
up. I will tell you, interacting with elected officials for many, many years, one story will not can will have more impact than any statistic that I can
Yes.
bring to the table.
Yes.
Just one story. And so as you go through the cancer journey as a patient, as a caregiver, what weighs on you and your mind, you need to feel empowered and supported in picking up the phone and calling your legislator or writing them an email.
Yeah.
You have to, otherwise they literally will not know.
Mm.
And so one story, always more impactful than any population level statistic I can bring.
Yeah.
Whatever you may think of as just something that you have to deal with. Mm-mm. If you're going through it, odds are thousands of others, hundreds of thousands, if not millions,
Yeah.
when we think of the
Absolutely.
society, are going through. So be the voice. You don't need anybody's permission to write to your congressperson. Just pick up the phone or write an email.
Yeah.
That's all it takes, and it gets on their radar. That's how healthcare issues, cancer issues get on our congresspeople's radar. So do it.
I love that. And I think for our listeners, I think it just echoes how powerful each and every one of you are, whether that's in the journey with the care you're receiving or the future of care that people will receive for decades to come. That, we as individuals may not think of ourselves as powerful in that space, but we are, and our stories are powerful, which is, why we even do this podcast, is that these stories are powerful. And just, to your point of that one conversation, look at how much ripple effect, that can have with change for others. That's incredible.
I hope every person feels, if they have never done so before, is to go on just Google search, who's my
Yeah.
representative, who's my senator, plug in their address and just send them an email. You don't even have
Yeah.
to interact. Just send an
That's right.
email.
Yeah. You never
And
know.
but that's how issues get on their radar. Otherwise, they frankly won't know. They just won't know.
Ishwaria, as we are wrapping up here today, we have listeners who are currently undergoing cancer treatment, survivors, caregivers, healthcare professionals. What would you want your message of hope to be for our listeners today?
There's so much about a cancer diagnosis that feels like things are being done to you.
Mm.
Certainly didn't ask for this diagnosis, certainly didn't want to be in this place in life. But here we are. I want each person to recognize just how much control they do have over this experience. There may be something happening that you didn't want to happen, but you can pivot how you and your family are experiencing during that. And so I would want each person to walk away feeling activated and feeling activated to take control where they can take control.
Mm-hmm.
If you're hurting, let's get whatever pain management support you can find. If you're not able to sleep, let's get whatever support that there is there to get you that quality of life. If you're not sure how to talk to your kids about cancer, let's find resources in the hospital, in the health system, in the clinic, in CanCare, on the internet, in reliable places on how to talk to your kids about cancer. If it's preparing for the future, it's finding out. It's exactly what do I need to do for my family to feel secure. And so it's truly about a message of activation and kind of reclaiming some of that control of this experience.
I love that. That's beautiful. And I know so many will embrace that message today. And I think you've imbued power back into their lives. So we thank you so much for that. And we thank all of you for joining us for this episode of Hope in the Face of Cancer. Please like and follow us to be notified of future episodes. And if you or someone you love is facing cancer, please reach out to us at CanCare. We can support you, whether you are facing a diagnosis yourself or caring for a loved one. You can go to cancare.org and be matched with a survivor by your side. No matter where you live in the U.S., we're here to support you. We see you next time on Hope in the Face of Cancer. Thank you for joining us on this episode of Hope in the Face of Cancer, a survivor by your side. If you or someone you know is facing cancer or is supporting a loved one through their journey, we invite you to share this podcast. Thank you for your support in our efforts in the cancer community. No one should face cancer alone.